Hi, I'm Dr. Katie. I'm the creator of the Tranquil Minds Anxiety Program, and I'm just popping on this video because I know that there's some questions around how naturopathic care and how the Tranquil Minds Program fits into your broader mental health care plan. Our traditional model when we're talking about mental health has really two options: medication and therapy. And so when something new comes along, such as naturopathic care, it can be sometimes difficult to figure out, hey, where does this fit in? So one of the biggest misconceptions that people have about naturopathic care is that they can't do medication or therapy alongside of it, that it has to be done by itself. And that's not true. So the Tranquil Minds program that I have designed is complementary to both medication and therapy. And it can be done without them as a more preventative piece. So when people are well and they're looking to optimize their mental health and prevent needing more care in the future, it's a good piece then. And it can also be done alongside therapy and alongside medication. So what is this piece then? Well, when we're looking to optimize mental health, a lot of practitioners, myself included, look at what's called mind-body medicine. We know that your thoughts affect your body, and what's going on in your body can affect your thoughts. This is why, medications are on that body affecting thoughts level, and therapy is on that thoughts affecting body level. Naturopathic medicine more falls into the body affecting thoughts level. And what we do is first we look at your habits. So we do an assessment of the 5 pillars of performance: sleep, nutrition, mindfulness, exercise, and connection. And we evaluate where those things are, and we also do a mood nutrient assessment. And that's the foundation of the Tranquil Minds program, and that's where we start. And so if your pillars are strong, if your mood nutrients are great, then we move on to advanced care right away. But for most people, we start our work right in the Tranquil Minds portion, in that foundational work. And over 6 weeks, we revamp your lifestyle step by step. We're not expecting you to change your life overnight, but what we do is help you look at where you are, where you want to be, and build little steps in between to help you get there in terms of your lifestyle. This is effective. It's far more effective than trying to make a big change all at once. And a lot of times, the reason we start with this is this resolves a lot of people's concerns. A lot of people feel a lot better after implementing these, and sometimes we don't even need to go on to the next phase, which is functional testing and assessment of your unique physiology. So we start with the nutrients because that is the most accessible, it's the most inexpensive, and it's where we catch the biggest problems fastest. We then do an assessment to where else in your physiology might be influencing your health. And this is really where I do the one-on-one work with my patients, and we're running blood work. So the categories we look at is cardiovascular health. I know it sounds crazy, but your brain needs blood. It needs blood to work. And so we focus on that. Then we do hormonal testing. We're looking at cortisol, we're looking at thyroid, we're looking at sex hormones, understanding how those are affecting your body and your brain and making sure they're optimal. We also look at digestion. How's your digestive health? There is a ton of information that goes from your digestive tract up to your brain. And we want to make sure that that information is great, that it's a positive connection, that we're doing everything to optimize the digestive health and maximize this gut-brain connection in a way that promotes good mental health rather than having barriers in the gut. And then the last thing that I talk about my patients with is their spiritual gifts, spiritual beliefs. Where are you making meaning in this world? Where are you putting your impact? And how are you putting that at the front of your health? Because that is something, when we're able to show up authentically, when we're able to bring our gifts to the world, truly lowers anxiety, lowers depression, increases our feelings of self-worth, and helps us share our light in the world, which is what I'm really about. And so that is what we cover under the Tranquil Minds framework, first in the Tranquil Minds program, and the second bit's in Tranquil Minds Mastery. And really, this is not psychotherapy. While I'm an active listener and I create safe space for my patients to share what's on their minds and what they need to tell me so that I understand their experience, we're not using psychotherapeutic techniques in naturopathic medicine to treat things. And so a lot of times my patients are still seeing their therapist unless they've sort of reached a plateau in therapy and their therapist and them have decided that a break from therapy is a good idea. They might come do the Tranquil Minds program for 2 months and then pop back into therapy. That's really something for you to work out with your therapist, but that's the main difference in the Tranquil Minds program. So I hope that helps explain what the process is, what it's like to work with me, and also kind of the difference between naturopathic medicine and therapy. So if you have more questions or you'd like to get to know me better or see if this is a good fit for your care plan, I invite you to book a strategy session. You and I can talk on the phone or through a secure video chat and just determine whether this is a great fit for you. And I'm happy to just help explain more about my process and learn more about you. And if this is the right approach to care, I'd love to meet you. And if we decide at the end of that visit that it's not the right fit for your care, I'll still be so glad to have met you. And so I'll put the link below. You can click on it. It takes you to a booking portal. And the appointment that you're going to want to book is called a naturopathic strategy session. It's on the left-hand side. It's the first appointment type. Once you click on it, the calendar will pop up and you can just find a time in my calendar and book yourself in. And I look forward to chatting.